Before choosing an IV cannula, pause for a second and ask, what does this patient actually need? The color helps us remember the size, but clinically the real concept is the gauge. A lower gauge number means a wider cannula, and a wider cannula can deliver fluid or blood faster. Yellow, 24 gauge, is one of the smallest commonly used peripheral cannulas. Think of neonates, children, or patients with very tiny, fragile veins. This is not a resuscitation cannula. It is useful when you need gentle access and slow infusion, and when preserving the vein is more important than speed. Blue, 22 gauge, is also useful for fragile veins, especially in elderly patients or difficult peripheral access. It can work well for medications or slow fluids, but if the patient is shocked or actively bleeding, this is usually not enough. Pink, 20 gauge, is the common routine adult cannula. For many ward patients needing IV medications, maintenance fluids, or standard access, pink is often a practical and safe choice. It gives moderate flow without being unnecessarily large. Green, 18 gauge, is where you start thinking about higher flow. It is useful for blood transfusion, perioperative access, or patients who may need larger volume fluids. When the clinical situation needs faster delivery, a larger bore becomes important. Gray, 16 gauge, is a large bore emergency cannula. Think trauma, major bleeding, shock, or rapid blood and fluid resuscitation. But remember, bigger is not always better. If the vein is poor, repeated failed attempts waste time. In emergencies, good access matters more than an impressive cannula size. So the take-home message is simple. Choose the cannula according to the patient's veins, the urgency, and the therapy needed. Fragile veins, yellow or blue. Routine adult access, pink. Blood or higher volume fluids, green. Trauma or rapid resuscitation, gray. And always remember, choose the smallest gauge that safely meets the indication. That is safer, more practical, and more patient-centered.